From under the Golden Dome in Charleston, this is the West Virginia Capitol Report.
Well, hello everybody, and welcome to this week's edition of the Capitol Report. I'm Bill Laird along with co-host Dave Perry, and we have a great show lined up for you today. Certainly healthcare is extraordinarily important to the citizens of the state of West Virginia, and we're pleased to be joined today by Mr. Chris Howe, who is the CEO, the Chief Executive Officer of Plateau Medical Center here in Oak Hill. And Chris, welcome to the Capitol Report show.
Thank you for having me. Appreciate it.
You bet. Again, a lot of excitement in the community. There's been a major commitment of funds to provide for not only the expansion, but some major renovations occurring here at Plateau Medical Center. I think we had the opportunity to talk with you earlier when that project was just getting underway, right. But if you could kind of bring us up to date on that major project.
Sure, yeah. So actually in April of 2018, we did our official groundbreaking ceremony for this project, something a long time coming, and I know the community been looking forward, and we were really excited to move forward with. And since that time, there's been a lot that has developed. We have our new 15,000 square foot building is probably about a month and a half away from completion. So in that new building will be 2 brand new operating rooms. We'll have a brand new post-anesthesia care unit, about a 8-bed PACU as it's known. Have a brand new lab, brand new central sterile. So again, that will be finished around the end of May. And in addition, we have a major interior renovation, cosmetic renovation underway as well. We've actually just finished, we're nearly probably 90% finished with renovation of our second floor, which is where outpatient surgery is. Brand new, everything on the interior essentially has been renovated. Everywhere that a patient would go in that area has been renovated. And then we will do take that same approach on all of our other areas as well. We have all of our private patient rooms. We're all private patient rooms here at Plateau Medical Center are going to be renovated. And then we're also doing a lot of work in our emergency department. We're expanding the size of our emergency department from 9 to 10 bays. We're expanding the size of the waiting room. We've got a brand new grand front entrance that we're going to have at Plateau Medical Center. And several other things as well, kind of on the back end for some of the support staff, new bathrooms, new lounges, new physician dictation area, but really investing a lot in the areas within the hospital.
Chris, Plateau Medical Center is a critical care hospital.
Critical access, yeah.
Critical access means what? Or how do you delineate between a critical access hospital and a regular, normal setting?
Yeah, it's a designation essentially by the government for the way that hospitals are regulated, but we're a 25-bed critical access hospital. That means we really can't go above 25 beds. It has to do with the length of stay, the average length of stay for the amount of time that a patient would spend here, generally under about 96 hours. But while we are critical access hospital, we provide a lot of really highly specialized services here that I think we want everyone to understand as well. We have a excellent orthopedics program, excellent general surgery, excellent ear, nose, and throat surgery, excellent endoscopy program. We have full service sleep lab, full service rehabilitation services, full service audiology, and the list goes on and on. But even though we're critical access, we have quite a bit here as far as services that can be provided to the community.
If I understand correctly, of course, there's a network of facilities that's been established in relation to Plateau Medical Center throughout the county.
Sure, yeah, we're actually, I think a lot of people occasionally think that Plateau Medical Center is the small hospital in Oak Hill, but we're actually, we have 9 locations throughout Fayette and Raleigh County and in 4 different cities. So basically from Beckley all the way north to Ansted, we have various offices: primary care, general surgery, ear, nose, and throat, sleep medicine, gastroenterology, specialty services, and a few that I'm probably forgetting, but many. There's too many to name, but we have quite a bit of various providers in our network.
Again, Chris, it's important, I think, for people to understand that it is indeed possible to receive quality care in the communities in which they live.
Right.
I think in dealing with healthcare issues, whether it be an acute healthcare condition, a chronic condition. People need to have confidence that they have access to quality of care. The standard of care would be the standard of care whether you're in Oak Hill or Charleston, Huntington, Beckley. If you could talk a little bit about the focus and commitment of Plateau Medical Center to have that quality standard where people can feel comfortable in getting care in the communities in which they live.
Sure, absolutely. Well, there's actually ways to, I mean, obviously, you know, I personally think we provide and know that we provide high quality care, but there's actually ways to objectively verify that for a patient as well. So for instance, the Centers for Medicare and Medicaid Services, CMS, rates hospitals on their performance from quality to patient satisfaction to, you know, how many patients get readmitted after they're discharged, and they compile all those results into a rating system that's essentially based on star ratings. And we're a 4-star hospital. There's only a handful of those in the state and a handful of those across the country. So we do provide high quality care, and of course we're Joint Commission accredited, and there are other accreditations that we have that prove the quality of care we provide, but we take that very seriously.
Yep, absolutely. And I guess in defining, you know, the scope of services, certain service areas you may do, certain things you may choose not to do. I think probably in healthcare, it's pretty important to whatever it is that you're meant to be, that you do a good job within the limitations of those service lines that you may provide here locally. Right. How do you go back by determining you know, service areas that this community will support and some
right.
things that you perhaps let go and go elsewhere?
Sure, yeah. Well, I mean, basically we look at, I mean, you hit the nail on the head, but we believe in doing what we do here at Plateau Health in our network, and we're going to do the things that we know how to do, and we're going to do them very well. And we want to be the best at providing those services. And then there are some services, you know, highly specialized cardiology services or neurology services. You know, we really don't need to be in that service because it's highly specialized and it's not something that we do. And so we'll have, you know, agreements and arrangements with others that provide those services. But basically, we take a look at the services in the community, figure out where the gaps are, be it if it's in access, you know, if we can start a new access point to make it easier for patients to get the health care, you know, in the areas that they're in, we will do that. Or if there's a new service that is not in that area that makes sense for us to be in, sure. You know, we'll do that as well. But we don't believe in trying to be all things to all people. We have a core group of services that we provide, and we want to be the best at it.
I know you talked a lot about the facilities and the facility improvements. In addition to that, I think you've made some technological changes as well, such as the robotics.
Yeah, we have, you know, robotic surgery. A lot of people get intimidated by that, but it's really sort of robotic augmented surgery. It's the use of a robot to assist the surgeon in performing minimally invasive surgery, provides high definition viewing, more dexterity in the way the robotic arms work, usually has, you know, quicker recovery times, less pain, you know, quicker return to work, better outcomes. There are a handful of robots in the state of West Virginia, and then there are even a smaller amount of the latest in that particular form of technology. And we have actually the latest robotic technology in West Virginia right here at Plateau Medical Center. So we are one of the few locations that have that latest in robotics technology. So heavily invested in that. You know, we've started up a brand new ear, nose, and throat service surgery line this year, surgery service line this year that invested a lot of money to get that going. Have made, you know, improvements in our electronic medical record system. So yeah, that's a constant focus. I mean, technology is really, you know, at the heart of what we do, and we want to make sure we have the latest to be able to do it. And then of course, when we set up our new operating rooms that'll be built, you know, we'll have new technology in those operating rooms. In our new endoscopy suites, we're getting 2 brand new endoscopy suites as part of our renovation project. So we're basically doubling the size of our operating rooms and doubling the sizes of our endoscopy suites as well.
Chris, I know you have a very active emergency room, yeah. And I've often heard emergency rooms is referred to as sort of the front window of a hospital, in the sense that a lot of times the only contact the public may have is through through emergency situations in your emergency room. If you could just maybe tell us a little bit about you know, the emergency room here at Plateau Medical Center, and you know, if you have a condition that requires you to triage and transfer, I'm sure you all have that down well also.
Yeah, we do. So our emergency room is about 9 days right now. It'll go to 10. We see around 13,000 patients a year, which is quite a bit, about 35 or 40 patients a day. And yeah, we have a very, you know, we're very focused on the patient experience when it comes to our emergency department. We want to make sure that you see that you are triaged within a certain amount of time. We want to make sure that you see a provider within a certain amount of time. And we want to make sure that, you know, whether the decision is made to be admitted or the decision is made to be discharged, that all that takes place within a certain amount of time so that we can streamline that as much as possible and make the patient flow, if you will, or the overall time in the emergency department the right amount of time, and hopefully the shortest amount of time based on, you know, whatever condition somebody may present with.
Right. Well, unfortunately, our time has expired, but again, Dave and I really want to thank you for taking time out of your busy schedule to join us today on the Capitol Report.
Thank you, guys.
Okay, again, Chris Howe, the CEO at Plateau Medical Center, and again, the clear message is for quality health care right in the community in which you live. Certainly, Plateau Medical Center is focused on that mission. We're going to go ahead and take a break and be right back to the Capitol Report, so stay with us, everybody.
Stay tuned. The West Virginia Capitol Report will be right back. The West Virginia Capitol Report is brought to you by the AFL-CIO of West Virginia, Cucumber & Company, online at cucumberandcompany.com, and Mark Hunt & Associates, toll free at 800-554-1280. From under the Golden Dome in Charleston, this is the West Virginia Capitol Report.
Welcome back to the Capitol Report as we continue our focus on healthcare services in the state of West Virginia. And Dave, we're real fortunate to be joined today by a guest that is very knowledgeable concerning the delivery of healthcare services in rural areas. John Shultz, who's the CEO of New River Health Association. And again, John, welcome to the Capitol Report show.
Thank you. Thank you.
Okay, I'd like to maybe start off a little bit on a discussion. Again, New River Family Health has been an important part of the healthcare community in southern West Virginia for many years. And but again, you all are designated as a federal qualified health center, and maybe you could talk a little bit about the importance of Fqhcs on access and delivery of healthcare services in rural areas in West Virginia.
Sure. Federal qualified health centers came out of President Johnson's war on poverty in the 60s. And the purpose of them was to provide primary care services in underserved areas, whether that be rural or inner cities. It started out with 2 health centers, one in Mount Bayou, Mississippi, and the second one in Boston, Massachusetts. Now there's over 3,000 of them across the country providing primary care services. And in the state of West Virginia, there's 33 Fqhcs now.
Wow.
And they provide care to about 450,000 residents of the state, or 25% of the state's population calls an Fqhc their primary care home. So most are located in rural areas, others are located in some of the larger cities in the state, but it is an accessible organization for people to get to for their health care and dental needs.
And again, absent that from our provider network, we would have major gaps in rural areas in West Virginia.
Yes, that is correct. Here we're located in Scarborough and Fayette County. We're also located up in Nicholas County and Raleigh County. But again, most of our sites are in the rural parts of those counties where people would rather come than going into a Beckley or Summersville area for their primary care needs. And
again, the mission of your organization, I assume primary care is the emphasis and focus.
Yeah, the primary mission of the organization is to provide primary medical care, dental care, behavioral health services, as well as school-based health services in the schools that are in our service areas.
Right.
I know that part of that mission you just mentioned was school-based health centers, and that seems to be quite large in Fayette County and Nicholas and so forth. Where are your facilities located, and what do those facilities offer?
Sure. We have 8 school-based health centers. We're in Nicholas County High School up in Summersville. We're also in Oak Hill High School, Mount Hope Elementary, Coal City Elementary, Valley High School, and the elementary school in Valley, New River Elementary, and Independence High School. And we just opened a new site in Independence Middle School. So those are the sites we have. Some are located within the school walls. Some are located in modular units or mobile units out on the campus of those schools. And the services we provide medical, dental, and behavioral health at all those sites. So we have a dentist and a dental hygienist who rotates through the sites with portable dental equipment to get up there to do examinations and cleanings for the students. And then we're open every day the schools are in session. So we have a medical provider there whenever school is in session.
I know, being familiar with them, of course, it affected attendance, it affected students who otherwise would not get health care.
That's correct. I mean, it helps if the student, a lot of times, a lot of our patients have transportation issues, so if a student becomes ill in school or they come to school ill, rather than the parent taking a day off of work or the guardian taking a day off of work to take the child to the doctor's appointment, they can just walk down the hall to the school-based health center or outside to the unit and be seen by a physician assistant or a nurse practitioner. That way they don't have to leave school, the parent or the guardian doesn't have to leave work, and it's very convenient for the kids to get their care.
Now, not only you offer services to schools, I think sometimes these are open to the general public as well.
Yeah, they are open to the general public. It all depends on where they're located in the school, and it's really we leave that up to the principal and the superintendent to allow the general public to come in during the day. So most of our sites, we do see the general public in those because some are off campus and the other ones may have a separate entrance for the general public. So the other thing with our school-based health sites is a lot of the teachers and the school employees take advantage of those through the PEIA program. So instead of them having to leave school to go see a doctor or one of their other providers, they can come to the school-based health center and be seen during the school day.
John, how would other counties or other systems access such facilities, or what would be the mechanism?
Well, it's a process we have to go through because we're quite regulated by the federal government. So you have to go through a process, show that there's a need in your community, present that argument to the federal government saying we need to have a location in that school or that area of the county, and the federal government has to approve that so it can become one of your sites within the scope of your service.
John, I would have to assume that the passage of the Affordable Care Act and the policy decision in West Virginia to expand Medicaid coverage to uncovered persons did an awful lot to try to deal, at least initially, with our uninsured populations. But again, I assume philosophically and otherwise, you all have a commitment to provide affordable services to persons, and again, I assume the passage of that legislation, assisted federal qualified health centers in dealing with persons in certain socioeconomic categories.
It's helped quite a bit. I mean, before the passage of the Affordable Care Act and the expansion of Medicaid in the state, our uninsured population was about 30% of the patients coming in didn't have any insurance. Since the passage of that, our uninsured rate's down to about 15–16%, and pretty much that difference of about 15% went directly to the Medicaid population. So our uninsured population went down and our Medicaid population went up. And the other thing, as a federally qualified health center, we're required to do is offer what they call a sliding fee scale. So if you don't have insurance, or if you have a high deductible and you still meet the federal poverty level guidelines based on family size and income, we offer a sliding fee scale. So for example, if you are uninsured and you meet the minimum requirements, the minimum payment for a visit here would be $15 for medical, $35 for dental. And then the other thing I didn't talk about is we also have pharmacy services. So we have 3 pharmacies available in Scarborough, Sophia, and Fayetteville. And that sliding fee goes to the pharmaceutical pharmacies as well.
And some of the challenges that we face, with chronic illnesses, a lot of things attendant, I guess, to an aging population in the state of West Virginia. And, I'm sure that that comes into play as it relates to the scope and nature of the services provided by New River. I noticed, black lung, breathing, a lot of things that were sort of the byproduct of the industrial era in the state. And you all have certainly seemed to have a good focus on that.
Yeah, that's, some of the challenges we're facing within the state itself. It's an aging population. It's a sicker population. And we do have black lung for those folks who have black lung disease. We also have pulmonary rehab for individuals. They don't have to have black lung, but they can have some type of pulmonary illness that they can provide. We can provide pulmonary rehab. So yeah, you're correct, Bill, in that it's an aging population. We see a lot of diabetes, a lot of obesity, along with those other things. The newest thing we're doing as well is what they call medication-assisted treatment for those individuals who are addicted to opioid or heroin. We just started that about a month ago, and the point of the reason for that is to keep people, or try to keep people off heroin and get them on. We have a Suboxone where they come in every day for individual treatments, group treatments, individual counseling and group counseling. As well as getting their Suboxone right at our own pharmacy here.
I know New River has 5 sites in Fayette County, and it's my understanding that you all are talking about some possible expansion.
Yes, I'll give you a little scoop. We are looking at expansion. We just recently closed on a major building in Oak Hill, the former Kmart building, up in I think it's the Fayette Square Plaza. So we are in the process of looking at designing that into a medical mall for the Oak Hill and the Fayette County area in the near future.
So as a medical mall, would it be inclusive of all facilities and all offerings?
Yeah, the vision for that is we'd have services up there, medical, dental, pharmacy, behavioral health, and then talk to some people in the community who'd like to collaborate and who are in the wellness field or the health field to see if they'd like some of the space in that building. So it'd be almost what I consider a one-stop shop for people to get all their health and wellness needs taken care of there.
Wow, that's big news, and again, you hear it here first on the Capitol Report. So,
that's right.
Well, John, unfortunately our time has expired, but again, as a long-standing resident and member of this community, I really want to thank New River Health for your many years of commitment to health care here in this community, and it's just been an essential component in providing access to healthcare services, high-quality healthcare services here in southern West Virginia.
Well, thank you. I appreciate that very much.
Okay. Well, we're going to go ahead and take a break, and Dave and I will be right back, so stay with us, everybody.
Stay tuned. The West Virginia Capitol Report will be right back. The West Virginia Capitol Report is brought to you by the AFL-CIO of West Virginia, Cucumber & Company, online at cucumberandcompany.com, and Mark Hunt & Associates, toll free at 800-554-1280. From under the Golden Dome in Charleston, this is the West Virginia Capitol Report.
Welcome back to the Capitol Report as we close out today's show. And Dave, again, great guests here today, even though they tended to be a little bit focused in one area. But this is an example, I think, of the importance of small rural hospitals throughout the state of West Virginia, whether it be in Fayette County or any other county. And again, just great news that an expansion project underway at Plateau Medical Center. And hey, how about this late breaking news about a new facility for New River Health Associates? It just seems as if these folks are really on the ball front and center and concerned about delivering quality health care in the communities in which we live.
And I think it's an indication of establishing a commitment to the area, both with the $17 million investment made at Plateau Medical Center, which has been around for years, and the New River Health Clinic, which has been around since 1978. So it definitely tells the community we're interested and we're going to stay here.
You know, and again, that's a solid message. When you see new construction, that means they have sort of re-upped their commitment to the community and intend to be a player for many years to come. But again, the importance of the message from PMC's standpoint, if you're looking for high quality healthcare services, you can rely upon local services in your own community, and certainly New River Health Associates, again, a primary focus for many, many years as it relates to primary health care in West Virginia. So again, on behalf of co-host Dave Perry, I'm Bill Laird, thanking you all for tuning us in each week on the Capitol Report. Have a good week and goodbye, everybody.
This has been the West Virginia Capitol Report.